And I'm going to be brief, but this is a very important issue, not just to the state, but particularly to Prince George's County, Maryland. A county of over 900,000 people, and it's a second largest county in the state, over 1/6 of the state's population, and yet over 60% of the people in Prince George's County go outside the county for their health care needs. We're here to address a hospital that has been committed to by the state of Maryland since 2011. 2011, there was a memorandum of understanding by the state, the county, and the University of Maryland Medical System to move forward with a teaching hospital in Prince George's County. There were some delays on site selection, but now most importantly, delayed from the certificate of need. And so what this bill does is provide funding to conform this understanding to law and to move this project forward. This is not just a hospital for Prince George's County. It's a regional trauma center. Our own Senator Wall was flown there when he had his plane wreck. It serves all of Charles, Culver, St. Mary's, Anne Arundel, parts of Washington, D.C., and parts of Montgomery County. And so what I'm asking you to do is to pass this legislation, not vote on it this time. We're still working with the administration, the governor. The governor looks very favorably upon this project, but for whatever reason, when we put $15 million in last year in the budget for 2016, along with the aid to education, he chose to cut the $15 million. It's transitional monies that absolutely is essential to make this project work. This project means, utterly millions and millions of dollars in terms of job creation, economic development, and also recapturing 22% of the population that now moves out of state for its health care. So with that, I'd like to introduce, well, first of all, we have a couple members, some true citizens of Prince George's County, including our county executive and two of our fine board members. But if we could, I think the next person I'd like next to hear from, if you don't mind, is our county executive, Prince George's County, who would better fully explain the necessary for this legislation. Thank you very much, Mr. Chairman. Thank you.
Thank you. Thank you, Mr. President. Mr. Chair, Mr. Vice Chair, members of the committee. I think the President did a great job explaining where we are. We know that we've worked with you, Mr. Chair, on this issue for the last 5 years that I've been county executive. In 2011, we came up with a historic agreement between Prince George's County, Dimensions, and the University of Maryland Medical Center to move forward into a new regional medical center, not just for Prince George's County, a regional medical hospital, but for the southern part of the state of Maryland. We provided the funding that we agreed to in Prince George's County. We took on a $45 million deficit that was in the hospital so that we can provide health care to the southern region of the state. The reason it is unfortunate we're here today asking for a piece of legislation because the simple solution would be for the governor to release the $15 million that was in the budget, put in there by the legislature last year, and to put the $15 million that's needed in this year in the budget, and to commit to the ongoing commitment from the state to move this hospital forward. But that hasn't happened. And to be brutally honest, the county has lived up to its commitment to fund this hospital because it's needed for the most vulnerable population, the people who are uninsured and underinsured. As the President said, we've got the second busiest trauma center in the state. But the county, much like the state, can't be in the healthcare business forever. That's why this is such a historic agreement. We have made tremendous progress working with UMS. We've made it streamlined the finances of the hospital. We've improved health care. We're starting to see a resurgence of people coming back, but that's going to need the new regional medical center that's going to be built at Largo, which will also spur economic development. But we can't get to the new hospital if we don't have the ongoing operating funds. So we're asking this committee to support this legislation that will make sure, not only for Prince Georgians, but all Marylanders, especially in the southern region, have access to quality health care. The last thing I'll say, and I'll let the rest of the panel, is that, if Prince George's County's hospital goes down, that doesn't just affect, the hospital at Dimensions Healthcare. It affects Doctors Hospital. It affects Fort Washington. It affects hospitals in Montgomery County and in Anne Arundel County. This is a critical, important issue. It has been the #1 issue of the county in the legislature for the last 5 years. Thank you, Mr. Chairman.
Thank you, Mr. Executive.
Next, Mr. Tom Himmler is the Chief Administrative
Just go over some real numbers.
Thank you, Mr. President. Just to add a couple things to what the county executive said. Since the memorandum was executed in 2011, the county has committed over $105 million in operating funds, including the budget that the county executive is going to submit in March. We've also have $208 million of capital funds already approved for our share of the Regional Medical Center. And also, what we also did was a couple years ago, Dimensions had about $40 million of bonds outstanding. The county actually took those over and refunded them, so we're actually paying on that debt as well. So, we've worked together in our partnership with the state, with UMS, with the University System of Maryland. So we're ready to go. We have a site selected at Largo Metro Station that's going to spur jobs and spur over $1 billion of economic development activity. We're just need this funding commitment so that we can move forward.
If you don't mind, Mr. Chairman, Mr. John Ashworth is Senior Vice President of UMS and a professor.
Good morning, good afternoon, you all. Senior Vice President for the Medical System and Associate Dean for the University of Maryland School of Medicine. Been involved with this project for the past 4 years. The President of the Senate, Rashern, Tom, they basically are giving you really the background, the essence of the need. Just a very, very brief progress report. Yes, we have the site selected. Yes, we have a CON that is currently being reviewed by the Health Commission. And right now, the Health Services Cost Review Commission is also reviewing the rate order that would go with this. And very importantly, this is kind of the third leg of the funding, the county support, the state support, and then the support that we need that comes from the rates that are given to us by the rate regulator to help offset the costs that are associated with this. So we are looking forward to that CON approval, hopefully very soon. Clearly, this is an expensive project. Months of delay add cost to the project, and we are therefore very anxious to get the review completed. A piece of this review, though, is related to the financials, and the financials, to use the right word, are fragile. And items such as a $15 million of support from the state become very critical and essential to the review by the rate regulator relative to our financial projections. I would say also relative to progress, and by the way, I'm walking through what was in the MOU dated back in 2011, the areas that we said we'd all be working on. The development of an ambulatory care network. The county executive and his team basically have put together a clear understanding of what the ambulatory network will need to be for us to make this work. The University of Maryland Baltimore has been engaged in this relative to creating a health sciences presence on the campus at the Largo site. We have addressed the legacy liabilities that came with this. For those of you all who recall this, we had pension issues, we had debt issues, we had working capital issues. We've worked through those issues. We figured out ways to get to those, maybe with one pinch of the pension liability that we still need to address, which is within we can get there. But as importantly, over this period of time, one of our major goals has been to work with Dimensions to help improve in those areas of driving towards better operating results. We can't take what we know as Dimensions and put it into this new regional medical center. We've got to revise its operating model. We've got to work through those issues. We have been advisory to Dimensions, working with Neil Moore on this. There has been progress. There's a lot more to be done. Controlling costs, and laying the groundwork for us to move into the regional medical center. One of the areas that has been of a significant effort on our part and on the part of the School of Medicine has been working to develop during this interim period the clinical programs at Dimensions Health System. There's been mention of the trauma center as an example. This is the second biggest trauma center in the state, 4,000 admissions. Shock trauma is about 8,500 now. It is also the state's EMS system. It relies on this center as a high-risk, for a high-risk program in neonatal intensive care. These are the kinds of services that this facility, Dimensions, the Prince George's Hospital Center, was originally designed for. And yet, over time, we've lost some of that, with the exception of trauma and the neonatal care. We did lose it in the area of cardiac care. That is one of the areas where we have made a significant investment, and there are a series of other investments that we've made. And I think when you hear Dr. Bartlett in just a minute describe how all this has evolved, I think this is a statement of what the relationship with the University of Maryland Medical System and the School of Medicine and the campus is all about. So with that, I'd like, if it's okay with you, Senator Miller.
Good, right.
Okay, I'll turn it to Steve.
Obviously, people will be open to questions later, but this is our Surgeon-in-Chief, and he's Executive Vice President of the University of Maryland Medical System, Dr. Steve Bartlett, if you don't mind. Dr. Bartlett?
Thank you, Mr. President, Mr. Chairman, for the opportunity to speak on behalf of this outstanding program to bring a new regional medical center to...
Dr. Bartlett, excuse me, could you just turn that mic towards you a little bit?
There we go. Thank you again, Mr. President, Mr. Chairman, for the opportunity to speak on behalf of bringing the new regional medical center to Prince George's County. I want to tell you a little bit about some of the clinical programs that the School of Medicine has already invested in the Prince George's County, particularly at the Prince George's Hospital Center. Those are namely trauma, and we now have a 98% survival rate at the Prince George's Hospital Center, identical to the survival rate at the R. Adams Cowley Shock Trauma Center in Baltimore. Critical care for the people who have the greatest illnesses, sicknesses, particularly sepsis and cardiac. Emergency medicine, which is now at all three practice sites within the hospital system, as well as anesthesiology, orthopedics, and cardiac surgery. I do want to tell you a little bit more about the status of the cardiac surgery program. So you know, I had a chance to testify before HGO 2 years ago. At that time, asked for time to establish that program and allow it to get its taproot. It's what you're going to see now. It has more than gotten a root. It has absolutely become one of the finest programs in the state. So you see on the next page, we performed a total of 146 cases. Of those, 138 have required the heart-lung machine or open heart. There have been no deaths in those 146 cases. They might have expected from standard information you get from the Society of Thoracic Surgery to have had 2.4% deaths. They've also had no major complications. What's very important here, each year the Society of Thoracic Surgeons will assign a rating to a cardiac surgery program in the United States. When they come to assign a rating to the Prince George's Hospital program, they will give it a 3-star out of 3 rating. That's the best there is. Only 5% of cardiac surgery programs in the United States will receive that designation. With the results that they're getting, no one can exceed those results because they're perfect. Also, their outcome metrics are superior to what would be predicted, and that means they are able to do these without expending a great deal of cost. Next slide, please. As you can see, their complication rates, one stroke out of 150, one reoperation, but very importantly, no infections, no time spent on the ventilator, and no kidney failure. Next slide, please. And then one of the great measures of quality of a cardiac surgery program is how long does it take to remove the breathing tube after the surgery. National average, 47% is removed after 6 hours. At Prince George's Hospital, 84% of the patients get the breathing tube out after just 6 hours. Next slide, please. But ultimately, The thing that determines the cost of care is how long that patient stays in the hospital. National average for cardiac surgery is 6 days. At Prince George's Hospital Center, it's 5 days. So they're getting absolutely outstanding metrics. We just attended a press conference where 2 patients gave their stories of the very good experience they had at Prince George's Hospital, and I think you can expect to read in the media about the press conference around the extraordinary quality of that heart surgery program, thanks to Dr. Jamie Brown and the efforts of the staff at Prince George's Hospital and the School of Medicine. Another program that's done very, very well is orthopedic surgery, led by Dr. Andy Pollack. When he first came there, they were doing 165 cases. He's grown 52%, an average of 17% per year, and will do 613 cases this year. Even more exciting, on the next slide, you'll see that he is developing at the University of Maryland College Park in the Cole Fieldhouse a Center for Sports Medicine, Health, and Human Performance. That will be an outpatient orthopedic surgery, sports medicine office where you anticipate seeing up to 8,500 annual visits by 2020. There will also be 15,000 square feet of basic and clinical research space. I might add that any surgical cases that come from that clinic will ultimately be done at the Regional Medical Center, as well as an adjunct ambulatory clinic for sports medicine will be provided at the Regional Medical Center. These are some of the programs that we anticipate putting together in addition to vascular surgery and some of the transplant surgery that are soon to come. So I want to turn it back over to John to begin to summarize about what we see for the future.
So long and short of it is, we believe these investments are in our clinical programs. These are the types of things that we need, what we would call working capital for, to bridge our way into the future, and thus the reason why there is so much importance placed on the need for the operating support from the county, from the state, as well as the capital support as well.
Thank you. Judge Williams, or?
Federal Judge Alex Williams.
Yes, good afternoon, and let me thank you all for having us today. I am the newest member of UMP's board, and so I'm just trying to feel my way right now on some of the issues, but I speak for the 44 years that I've been in Prince George's County. And I want to capture what President Miller has said, that we have over 900,000 citizens that really need critical care. And the issue of proper and adequate and professional health care has been a challenge of Prince George's County for so many years. And not only is it going to be a boon to the economics that you've heard from our county exec, but it's just critically needed. And I can tell you now, too many of our citizens have to leave the county to get adequate care. And I, quite candidly, I'm tired of seeing so many of our residents move to the District of Columbia and to other counties to try to get the adequate medical care. So this is sorely needed in our county. Our citizens deserve it, and I think it's going to be a great and a powerful presence, not just for the county, but for the state.
Thank you, Judge.
Resident Board Member, Mr. Orland Johnson, please.
Well, thank you, Mr. President. Thank you, Mr. Chairman. I rarely have a chance to ever follow a federal judge, so this is really nice. But I just would like to say that this is a critical job, and we have a great organization, and someone who also chairs economic development for Prince George's County. I can't explain enough how this would be really a game changer in terms of making sure that as we go out and do more of what we're looking at, we've got over $5 billion worth of economic development activity going on, and to be able to demonstrate that we have a first-class healthcare delivery system is critical. One of the things, as a unique member of being from the county and also being on the board, we also have our own fiduciary responsibilities to make sure that we're doing what's in the best interest of UMS. So making sure that we have the right finances in place, but also making sure that we're doing everything that we can to ensure the viability of activity in our county is critical. I'd like to reiterate the fact that we have a number of individuals that are leaving the county. I've lived in the county for over 30 years, and I've had 3 children, and none of them were born in the county. because I was looking for some place to get probably the best health care that I could. And so I'd like to see us be put in a situation where we're not losing individuals that are going other places, but we keep that revenue here in the state of Maryland, and also be able to have a first-class system in a jurisdiction as large as ours that won't just benefit Prince George's County, but will also benefit the state of Maryland. And so the legislative support of this body and the governor is critical for us. So thank you very much, Mr. Chairman.
Thank you all.
Mr. Chairman, may I make a closing comment?
Please.
So what we know now from data that we have an opportunity to study from patients that go into Washington, D.C. for care, we know that 22,000 citizens of Prince George's County go to Washington, D.C. for their health care annually. Another 7,000 Southern Maryland patients go into D.C. for almost 30,000 patients leaving the Southern Maryland area every year. If we can move those patients back into Maryland, allow them to receive their care in Prince George's County, we're going to generate new jobs. For every 5,000 patients that are brought back to Prince George's County, we will generate 800 new jobs. We speculate that within 3 years, we'll be bringing at least 10,000 of those patients back, if not more, creating more than 1,600 new jobs. This is really something that will ultimately have tremendous positive economic benefit for the Prince George's County and the state of Maryland, but also lead to much better quality of care for those patients. Thank you, sir.
Thank you all. Any questions for the panel? Senator Peters.
Thank you, Mr. Chairman. Comment and question. First of all, I wanted to thank the chairman and the committee. Last year, we received a budget from the House that did not have the $15 million in operating. And Senator Curry's leadership, and along with me, Chairman's support, Vice Chairman, we put the $15 million in the budget. The governor has not released that money, as you're aware of. And the president is pushing forward for the next $15 million. Again, we hope that the governor will work through it with us on the budget on this issue, but we're prepared to move forward one way or the other on it. Second, Dr. Bartlett, I wanted to thank you for all your work you're doing with Laurel. I know that you're trying to restructure that hospital, and I know you've been working with the Laurel delegation. I have a small part of Laurel. It's a critical piece. Could you just kind of update us on where you are with it?
Yes, thank you, Senator. I'm very pleased that you asked. Just in the last 24 hours, we've reached an agreement on a process that will allow us to come to conclusion in our forward planning about what will be the successor program in Laurel, and we expect to reach agreement on that in 30 days. We've agreed to weekly meetings to study each of the clinical scenarios, emergency medicine, operating rooms, observation beds, perhaps obstetrics. And in each of those programs, we'll decide what is feasible, what is financially viable, and we'll have all the experts in the room. And at the end of the day, I'm hearing from Senator Rosa Pepp, Mayor Moe, Mary Lehman, and Delegate Pena Melnick that we're prepared to get to agreement, and I'm very confident that will occur.
Okay. Thank you, Mr. Chairman.
Any other questions? This summer, the committee visited the site and toured it and was very impressed. The county executive was with us and leadership from the UMS was there. It was a good day. Anyone else? Thank you all very much. Thank you. Is there anyone else who wants to testify on Senate Bill 324? Okay.